Despite the fact that fables about it flourish, this type of treatment is frequently useful. Trance is perhaps the most seasoned type of psychotherapy in the Western world, and it might likewise be the most misconstrued. Albeit since quite a while ago connected with scoundrels or entertainers, all obvious hypnosis is, by definition, personal hypnosis. Regardless of the overarching fabrication, it's not possible for anyone to be hypnotized without wanting to. Rather, hypnosis is commonly actuated by concentrating consideration on positive mental symbolism. A spate of papers on the theme have encouraged clinicians to recall that this treatment is an alternative when caring for patients. Clinical hypnotherapy can be an incredible strategy to remedy different mental health issues. By making a quiet and controlled condition, it permits people to concentrate on their most profound disruptors. Trance, or hypnotherapy, utilizes guided tranquility, exceptional fixation, and centered consideration regarding accomplish an elevated state of mindfulness that is once in a while called a trance. The individual's consideration is so engaged while in this condition anything going on around the individual is incidentally shut out or disregarded. In this normally happening state, an individual may center their consideration, with the assistance of a qualified therapist, on explicit contemplations or errands. How do we define hypnosis treatment? Clinical hypnotherapy works through its capacity to expel all interruption from the brain of the patient, and talk plainly and straightforwardly about close-to-home traits that need their consideration. It is frequently used to help change the patterns of people, yet doesn't depend on control, pressure or impulse to accomplish a constructive result. Misguided judgments about hypnosis treatment are typical, however its genuine utility as a treatment choice confesses all methodology, no chemicals or drugs are utilized, and its achievement in dejumbling the brain of stresses and disturbances, accordingly permitting the patient to concentrate totally on the job that needs to be done. Numerous people benefit from hypnosis for anxiety and extreme sadness, while others use it to break liberated from extreme fears, mental fatigue, negative eating habits or learned behaviors, for example, smoking. Sexual brokenness and discomfort. The border among the other regular territories of center for which hypnosis treatment can be valuable. Clinical hypnotherapy is frequently utilized related to cognitive behavioral therapy, a treatment blend which has demonstrated to be especially successful in accomplishing improved patient well-being. At what point should someone think about trying hypnosis? Various hypnotic procedures exist, joining relaxation with symbolism. Patients who experience hypnosis may accomplish a trance-like mindset, like what happens when they wander off in fantasy land or meditate. Be that as it may, hypnosis is really a heightened mindset of focused attention. The point is to center the psyche to dispose of interruptions and make somebody increasingly open to proposals, for example, those that advance the points of treatment. Mesmerizing was condoned as a treatment by the American Medical Association in 1958, and the American Psychiatric Association followed their lead in 1961. From that point forward, studies have given evidence about when this treatment is viable. A meta-investigation distributed in 2000 reasoned that hypnosis offered moderate to significant alleviation for some sorts of pain. What's more, a 2003 investigation found that hypnosis was now and again more viable than other discomfort relief strategies. Spellbinding might be utilized as a subordinate to different kinds of sedation during surgery. A 1999 discovery inferred that hypnosis joined with mental sedation may likewise diminish length of remain in the emergency clinic by speeding recuperation. A 2007 experiment found that ladies who were hypnotized before experiencing a bosom biopsy or lumpectomy required less sedation during the strategy, and experienced less nausea, mental distress and pain a while later. Research additionally reports that hypnosis can be compelling for relieving discomfort brought about by chronic strained cerebral pains and migraine headaches. Trance additionally assists with soothing anxiety. It has been concentrated most as a remedy for anxiety identified with medical procedures. Numerous discoveries have announced that hypnosis diminished anxiety levels and reduced blood pressure in people before surgery, and improved recuperation a while later by shortening hospital stays and lessening complexities like nausea and heaving. In a 2006 discovery, for instance, patients who experienced hypnosis got proposals of well-being before medical procedures. After going into the working room, they revealed anxiety levels 56% lower than anxiety levels before hypnosis. Individuals in an examination gathering, who got the typical presurgical standard of care, revealed a 47% expansion in anxiety. In what ways does medical hypnotherapy operate? Clinical hypnotherapy permits the person to envision in detail a wellspring of anxiety while in a controlled setting. The patient is then urged to enter a state of profound tranquility, as opposed to permitting the anxiety to develop. This matched action causes the brain to relate the potential anxiety trigger together with a more peaceful state of mind, permitting the mind to start constructing new and healthier pathways of conduct and emotional reaction. Simultaneously, the hypnotherapist gives quieting proposals to the person under hypnosis, with an end goal to show that person a way toward healthier living. Remembered for these messages is an encouragement to see the world in a progressively positive light, by grasping a liberal standpoint toward the general condition. During every hypnotherapy meeting, the patient stays wakeful and clear, and in full control of each choice with respect to whether to follow up on the recommendations made by the hypnotherapist. The length of treatment shifts as indicated by the issue being taken care of, just as the mental condition of the person. Mesmerizing is normally viewed as a guide to psychotherapy on the grounds that the hypnotic condition permits patients to investigate painful contemplations, emotions, and recollections they may have avoided their conscious minds. What's more, hypnosis empowers people to see a few things in an unexpected way, for example, hindering a consciousness of discomfort. Entrancing can be utilized in two different ways, as patient analysis or suggestion therapy. Examination therapy. This methodology utilizes the relaxed state to investigate a potential psychological foundational reason of a disorder or indication, for example, a traumatic past occasion that an individual has covered up in their unconscious memory. When the trauma is uncovered, it very well may be tended to in psychotherapy. Recommendation therapy. The hypnotic condition improves the individual ready to react to proposals. In this way, hypnotherapy can enable a few patients to change certain behaviors, for example, halting biting of the nails or smoking. It can likewise assist people with changing discernments and sensations, and is especially helpful in curing discomforts. How does hypnosis benefit depression and anxiety? Entrancing has an expansive scope of uses, because of its general capacity to improve the intensity of fixation and recommendation. Normal attributions of medical hypnotherapy include decreased sentiments of anxiety or extreme sadness, and recuperation from extreme fatigue. Restored sentiments of discretion. Expanded resistance for pain under particular parameters. Expanded capacity to disengage from over-the-top actions and habits, including smoking. An all the more decidedly arranged perspective. Expanded capacity to concentrate on stressful articles and thoughts while remaining mentally adjusted. Mesmerizing likewise may be utilized to help with discomfort control and to conquer negative patterns, for example, the overconsumption of food or smoking. It likewise may be useful for patients whose indications are extreme or who need crisis the board. By making new scenarios for individual empowerment, hypnosis gives people the inside instruments expected to conquer the unhelpful gathering of emotions and patterns that made them look for help. The amount. Does hypnosis treatment actually work? Common human inconstancy implies that a few patients are more open to suggestibility and hypnosis than others. By and large, be that as it may, it is powerful to utilize hypnosis for extreme sadness and anxiety as a component of a bigger course of treatment. Specifically, research shows that cognitive behavioral treatment gives a successful supplement to hypnosis treatment for issues, for example, acute stress disorder. A progressively broad meta-examination uncovers across-the-board improvement in numerous regions because of the mix of hypnosis with cognitive behavioral therapy. The study additionally discovered supported enhancements subsequent to estimating patient results long after the time of treatment had finished. Despite the fact that it doesn't guarantee a total fix in all cases, obviously hypnosis, with its capacity to clean up the clamor of everyday life during treatment meetings, can have a noteworthy, beneficial, and durable impact on conduct adjustment. On the off chance that you or somebody you know encounters mental well-being issues, it is essential to look for help from a certified proficient. What is the actual treatment procedure? Spellbinding treatment starts decisively when the hypnotherapist enables the person to accomplish a trance-like state, where outside interruptions are evacuated and the voice of the hypnotherapist is set at the focal point of the patient's mind. Once in this condition, the person is urged to investigate inward contemplations and emotions, which the individual can see with the kind of uncommon clearness that is regularly connected with meditation. This freshly discovered fixation lets patients utilize the entirety of their inward assets to think about the issues that in any case inconvenience them, regardless of whether drugs, alcohol or cigarettes, terrible experiences, or problems which conventionally cause stress for the person. The hypnotherapist goes about as a guide for the patient during this period of investigation, recommending a quiet and observational way to deal with each distressing wonder, as opposed to a natural abrasive response. After a moment of thought, incorporating mental experiences with the provocative improvements, the hypnotherapist urges the person to enter a state of deep rest. Through each progressive treatment, the patient figures out how to adapt to the truth of the thing dreaded or the object of fixation, and afterward watch it from a withdrew space, before moving past it and into a mindset of relaxation. The exercise of separation and equalization turns into an educated aptitude, engaging the person to manage stressor in a healthier manner in their regular life. What are the leftover questions about hypnosis? For different issues, the proof about the viability of hypnosis is blended or inadequate. One experiment including 84 patients with depression, who were arbitrarily allotted to about 4 months of treatment with either hypnosis or cognitive behavioral treatment, found that the two gatherings improved with therapy. The hypnosis bunch made more prominent upgrades than the cognitive behavioral therapy bunch when side effects were appraised on scales, for example, the Beck Anxiety Inventory and the Beck Depression Inventory. However, the increases were little. An examination found that numerous discoveries gave not many points of interest, that the hypnotic intercession couldn't be recreated nor assessed. Further research around there is required. A few scientists question whether people with this illness are fit for being hypnotized, while others stress that hypnosis may trigger a psychotic scene. Despite the fact that case reports proposed that hypnosis may enable a few patients to improve focus, concentration, and brainwork, a far-reaching review reasoned that the accessible studies were excessively little, inadequately structured, and obsolete to give any direction. Some research proposed that hypnosis may assist patients with halting smoking by decreasing desires, reinforcing self-control, or expanding center around healthier decisions. However, a comprehensive study found that most evidence to date comprised of case reports or ineffectively planned studies, and it reasoned that hypnosis is no superior to different intercessions, or even no treatment by any stretch of the imagination, on 6-month quit rates. Is there any downside to hypnosis? Entrancing probably won't be fitting for an individual who has psychotic side effects, for example, delusions and hallucinations, or for somebody who is utilizing alcohol or drugs. It ought to be utilized for pain control simply after a doctor has assessed the individual for any physical ailment that may require medical or surgical procedures. Entrancing additionally might be a less viable type of treatment than other increasingly customary therapies, for example, medicines, for psychiatric conditions. A few therapists use hypnosis to recoup conceivably subdued recollections they accept are connected to the individual's mental condition. In any case, the quality and unwavering quality of data reviewed by the person under hypnosis isn't constantly dependable. Also, hypnosis can represent a danger of making bogus recollections, as a rule, because of unintended proposals or the posing of driving inquiries by the therapist. Consequently, hypnosis is not, at this point, considered a typical or standard piece of most types of psychotherapy. Additionally, the utilization of hypnosis for certain mental conditions wherein people might be exceptionally powerless to recommendation, for example, dissociative disorders, remains particularly disputable. Step-by-step instructions to find a trustworthy hypnotherapist. Numerous states don't manage hypnotherapy. To locate a reputable therapist, inquire as to whether the individual is licensed, not simply certified, to practice. Or then again check for enrollment in the Society for Clinical and Experimental Hypnosis or the American Society of Clinical Hypnosis, which are two broadly recognized associations for authorized experts in this area. Thanks for watching. Don't forget to like, comment and subscribe for more tips, information and advice from Wellness World.